Greetings from Southern California. I'm Tim Hunt, an Associate Editor for the Journal of Arthroscopy. Welcome to the May 2015 issue. This is a special issue. It's the second and final part from ESICAS on biologics. There are 5 systemic reviews and 2 expert opinions. The topics include meniscal allograft, meniscal scaffolds, as well as biologic augmentation and tissue engineering of the meniscus. There are articles on synthetic ligaments, biologic augmentation and tissue engineering of ligaments, as well as biologic intervention of muscle and tendon injuries. For each of these articles, there is editorial commentary by Dr. Lubowitz, our editor-in-chief, which nicely summarizes the topic and brings them together in the big picture. There are 15 original articles. There's one on the hip about complications and survival analysis after hip arthroscopies in the UK using a large database. There's one cadaveric elbow study about topographic analysis of the capitellum and the distal femoral condyle and attempts to match those when treating OCD of the humeral capitellum. There are 8 original knee articles. There are 4 articles about the ACL. There's 1 article evaluating meniscal allografts postoperatively comparing MRI and second look arthroscopy. There's 1 article about arthroscopic surgery for discoid lateral meniscus in children. There are 2 about the posterior cruciate ligament. 1 attempts to assess for the optimal femoral tunnel position in posterior cruciate ligament reconstruction using an outside-in drilling technique. In this study, they used a computerized model and synthetic sawbones. There's also 1 article by Lee and colleagues about tibial tunnel aperture location during single bundle PCL reconstruction. They compared tibial tunnel locations via postoperative CT scan between the medial method, in which the PCL guide is placed between the PCL and the medial femoral condyle, allowing the PCL guide to go underneath the PCL, and the lateral method, in which the PCL guide is placed between the PCL and the ACL, which allows the PCL guide to go over the PCL. There is a nice video accompanying this of the technique. The authors concluded that the lateral method may result in better placement of the tibial tunnel within the anatomic footprint. There are 5 shoulder articles. 1 is from a large database about the 30-day complication rate after shoulder surgery and the risk factors for those complications. There's 1 cadaveric study about long head of biceps tenodesis with a knotless suture anchor technique, comparing the different suturing techniques of the bicep stump. There are 2 regarding corticoclavicular joint reconstruction. One of these is a cadaveric biomechanical evaluation of the effect of coracoid tunnel position and size. There's a second about complications after corticoclavicular joint reconstruction using a single adjustable loop length suspensory device in acute AC joint dislocations. There is an editorial commentary about this very topic in this edition about AC joint reconstruction complications and innovations. Finally, there's an excellent Level 1 randomized control study from Francinito, Milano, and colleagues comparing the effects of norepinephrine versus epinephrine in the irrigation fluid on the incidence of hypotensive bradycardic events during arthroscopic rotator cuff repair with interscaling block in the beach chair position. The authors concluded that norepinephrine reduces the incidence of hypotensive bradycardic events while being as effective as epinephrine in controlling intraoperative bleeding and maintaining the surgical field. The authors point out that the mechanism of action are different for these 2 different catecholamines. I hope that you enjoy the May 2015 edition. Thank you very much and goodbye.